Before using Tocilizumab syringe, it's important to read the medication guide and instructions for use provided by your pharmacist, and ask your doctor or pharmacist if you have any questions. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional and the product package. Before using the medication, take it out of the refrigerator and let it warm up to room temperature for at least 30 minutes if you are using the prefilled syringe, or at least 45 minutes if you are using the autoinjector. Do not heat the medication in any other way, and check it visually for particles or discoloration before using it. If you are using this medication to treat rheumatoid arthritis in adults, your doctor will usually start you with once every 2 weeks, then increase to once a week. For children with PJIA, the usual dosage is once every 2 or 3 weeks, based on the child's weight, while for children with SJIA, it is usually once every 1 or 2 weeks, also based on the child's weight. If you are using this medication to treat giant cell arteritis or for SSc-ILD, the usual dosage is once a week. The recommended injection sites include the abdomen or the front of your thigh. The outer area of the upper arms may also be used if another person is giving you the injection. Clean the injection site with rubbing alcohol before injecting each dose, and change the injection site each time to lessen injury under the skin. Do not inject into moles, scars, bruises, or areas where the skin is tender, red, hard, or broken. Make sure to learn how to store and discard medical supplies safely, and use the medication regularly to get the most benefit from it. Mark the days you need to inject the medication on a calendar to help you remember, and tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Tocilizumab syringe include headache, irritation, redness, or pain at the injection site. These symptoms may improve over time, but if they persist or worsen, it's important to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. In fact, many people using this medication do not experience serious side effects at all. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as stomach or abdominal pain. Tocilizumab has been known to rarely cause very serious, and potentially fatal, liver disease. This effect may occur months to years after starting the medication. It's important to be vigilant and seek medical attention if you develop symptoms of liver disease, such as persistent nausea or vomiting, loss of appetite, yellowing of the eyes or skin, or dark urine. While it's rare, a very serious allergic reaction to tocilizumab may occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not an exhaustive list of possible side effects, so if you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Tocilizumab, be sure to let your doctor know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Make sure to also inform your doctor about your medical history, especially if you have diabetes, infections, liver problems, low blood cell count, nervous system problems, or stomach/abdominal problems. Tocilizumab may increase your risk of getting infections or make current infections worse, so it's important to avoid contact with anyone who has a contagious infection. Also, tell your doctor if you live in or have traveled to areas where certain fungal infections are more common. Before getting any immunizations or vaccinations, be sure to let your healthcare professional know that you are using Tocilizumab. Using drugs that affect the immune system, like Tocilizumab, may increase your risk of certain cancers. If you have ever had any type of cancer, make sure to inform your doctor. Before undergoing any surgery, make sure to inform your doctor or dentist about all the medications and products you are using. If you are pregnant, Tocilizumab should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult with your doctor before breastfeeding. It's important to be aware of potential drug interactions with Tocilizumab syringe. Other drugs that affect the immune system, like certolizumab and corticosteroids including prednisone, may interact with tocilizumab syringe. This medication can also speed up the removal of other medications from your body, which may affect how they work. Examples of affected drugs include omeprazole, warfarin, and some cholesterol drugs such as atorvastatin/levastatin/simvastatin, among others. Additionally, tocilizumab syringe may decrease the effectiveness of hormonal birth control, such as pills, patch, or ring, which could lead to pregnancy. It's important to discuss with your doctor or pharmacist if you should use additional reliable birth control methods while using this medication. Also, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Remember to consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much tocilizumab and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to seek help as soon as possible in case of an overdose. It's important not to share this medication with others. Before starting to use tocilizumab syringe, you will need to undergo lab and/or medical tests, such as complete blood counts, liver function, and cholesterol tests. These tests should also be done while you are using the medication. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. Be sure to take tocilizumab syringe as directed by your healthcare provider. If you happen to miss a dose, consult your doctor or pharmacist immediately to determine the best course of action. When storing tocilizumab syringe, it's important to keep it in its original package in the refrigerator, away from moisture. Make sure not to freeze it, and definitely don't store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to getting rid of any leftover tocilizumab syringe, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. When the product expires or is no longer needed, be sure to properly dispose of it. Your pharmacist or local waste disposal company can provide guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.